Good afternoon, everyone. I'm Brenda Jegaday, and I am the Director of the Bureau of Health and Wellness. And I want to welcome you all today to our Government Alliance on Race and Equity, or GARE, Survey Results Town Hall. I am also a member of our department's Diversity, Equity, and Inclusion Council and a co-lead of one of the action teams of the council, and that's the Culture and Climate Action Team. And after I say a few introductory remarks, we will have an opportunity to hear from our Diversity, Equity, and Inclusion Council co-leads. GARE's Director of Survey Research will provide us with an overview of our department's survey results. And then we will also have an opportunity to respond to questions that were submitted in advance of today's town hall. And we'll also respond to questions that are asked during the town hall. And finally, we'll discuss some of the next steps. And I want to say our acts to each of you as we strive to implement strategies to address the needs of our Michigan residents and in our various programs across the department. So we wanted to begin by reflecting on why our department really exists and what MDHHS aims to accomplish. We can go to the next slide. Many times organizations, they will refer to missions as a guiding star, just helping us to direct our decisions, our actions, our priorities. And we want to set the tone today for our time together and remind ourselves that race equity and striving to improve the lives of our Michiganders, all Michiganders, is central to our department's mission. And as MDHHS employees, we are entrusted to provide each resident with access to our programs and our services with the goal of each person living the highest and healthiest, I want to say, lives. And as you see here on the slide, the mission of our department is to provide services and administer programs to improve the health, safety, and prosperity of the state. The vision of our department is to deliver health and opportunity to all Michiganders, reducing intergenerational poverty and promoting health equity. And our department's Diversity, Equity, and Inclusion Council mission is to promote and foster a culture that values diversity, equity, inclusion throughout the department and the very diverse communities we serve to achieve our highest potential. And the words that stand out for me today are residents of the state of Michigan, delivering health and opportunity to all, and achieving our highest potential. And just wanted to note that in addition to our mission and our vision, our work is guided absolutely by our state and federal laws. And as one example of a law that we're guided by is our public health code. And it states that the department shall continually and diligently endeavor to prevent disease, prolong life, and prevent and control the health problems of particularly vulnerable populations, vulnerable population groups. And we know that vulnerable populations are those who are at greater risk of poor health status, of those who have experienced disparities in life expectancy, disparities to access and to use of variety of services, access to services. And in the United States and in Michigan, these disparities are experienced overwhelmingly by our racial and ethnic populations. So we embrace our strategies, including actions to improve outcomes for all residents. We also wanted to note that it is so important when we're having discussions and connections like this for us to define terms when we use them. It really helps us, in these conversations and potentially, I'll say, discussions that can sometimes have emotional responses to words and phrases, and namely discussing race, diversity, equity, and inclusion. And for today, we wanted to elevate these two that you see on the screen is our MDHHS definition, and then also GARE's definition. And you can see in GARE's definition, which was included in the survey that many of us responded to, racial equity focuses on eliminating disproportionalities based on race and lifting up outcomes for all groups. And disproportionalities refer to instances where, particular groups are represented at a significantly higher or lower, I would say, rate than would be expected based on their portion of the general population. So I think of an example of Black children, I would say, represent about 14% of our total population, but 22% are about 22% are represented in the foster care system. So we would want to try to understand that disproportionality and address factors contributing to that disproportionality. And for our department's definition, it says the condition where one's racial identity has no influence on how one fares in society. An inclusive approach to transform structures towards access, justice, self-determination, redistribution, and sharing of power and resources. And this definition really speaks to examining and understanding and addressing the myriad of factors that contribute to some of the disparities that we see in many areas: healthcare, human resources, education, labor, housing, many of our systems. And race equity strives to understand both the past, addressing present conditions, and then also creating the best opportunities for the future. And then finally, just wanted to share before I turn things over that in 2019, on the next slide, our department, we completed the GARE survey back in that time, 2019. And we really wanted to see where we were in terms of understanding terminology, building our awareness, etc. And after that survey, our staff, told us that they wanted us to build our awareness, I should say, around equity practices within the department, to grow our capacity, wanted to see some increased visibility and leadership. And these are just some of the actions, a few of the actions that we have taken since that time. We've done a lot around improving practices to be more equitable. We developed a hiring toolkit requiring internal panels to definitely review and think about bias. We've had a leadership conference. We absolutely, and is very happy that we've created an equity and inclusion coin to recognize the work that many of our staff are doing, the commitment that you have around equity practices, and just requiring continued capacity building around learning and education. So I am going to stop there, and I just want to say I am extremely happy, honored to be just joined here by some incredible leaders in our department, who by virtue of their time and energy in both planning and participating in this moment will talk to you about, our ongoing commitment to this work. So at this time, we'll hear from David Kniezek, our Chief Operating Officer and co-lead of the Diversity, Equity, and Inclusion Council.
Thank you, Brenda, and good afternoon to the 385 of you that have joined us for today's conversation. I'm excited to be here. I'm excited about the conversation that we have ahead of us. When the GARE survey had been completed, I had an opportunity to go through those results and look at some of the quantitative numbers, but then also take a look at some of the free-form responses that people had shared and feelings that they had shared around this work and how it may or may not be impacting them. And there were two things that stood out to me that I wanted to call attention to. And kind of to Brenda's point, when we talk about words and the importance of those words that we use, address them from my perspective, if you will. The first was this theme around the notion of reverse racism. That someone who comes from a member of some majority could be on the receiving end of racial thoughts or racism itself. I'll share with you a story, as I am often to do. Many years ago, I had been invited by an organization to attend an event on the east side of Detroit. And so I drove my 40 minutes over there, and we were in the gym at one of the local high schools. And I'd say there's probably 400 people there. I was the only white guy in attendance, right? And so I'd been asked to speak initially, and I got in the front row of this conversation. And one by one, the organizer of this event was going down the row and calling up speakers. And so at one point, it's my turn. I'm getting ready. I'm grabbing my papers, getting ready to stand up, and the organizer skips right over me and goes down the line. And 2, 3 hours later, we finished the event, and I wasn't given the opportunity to speak. So I felt some type of way about this, right? I went up to the organizer after the event and I said, "Hey, what was that all about? I came this way. I was really looking forward to talking to folks. Why didn't you give me the opportunity to speak?" And he very gently put his hand on my shoulder and very matter of factly looked me in the eye and he said, "David, I don't like white people. I don't care what you have to say. I don't want to listen to what you have to say." And he said it so kindly and so softly and so matter of factly, but I felt so wronged by that, right? I felt really hurt by that in that moment. I thought it was wrong. And was it wrong of him to say? I think so. Was it prejudiced for him to say something about that because of the color of my skin? Absolutely. Was it discriminatory for him to feel that way because of something against the color of my skin? Absolutely. Was it reverse racism? Absolutely not. This is a distinction that I think we need to make as we're having these conversations. Anybody is capable of having feelings of prejudice. Anybody is capable of having feelings of discrimination. And I think it's right that we call that out, no matter what those feelings of prejudice and discrimination might be. It could be your race, could be your gender, could be your orientation, you name it. When we talk about racism, what we are talking about is that prejudice and that discrimination married together with power. And it's that proximity to power, when that prejudice and that discrimination is married with power, that we get into the world of systemic racism, real racism, that keeps people from getting to where they want to go, to where they want to be. It's not just attitudes. It's not just attitudes. And I can't say this enough because I hear it a lot from folks. The attitudes are real. The attitudes are real. But if it lacks that proximity to power, we are not talking about racism. And when we are in the roles that we're in here at the department, and you talk about systems or systemic oppression or systemic racism, we at DHHS are a part of one of these systems that is positioned to hold people back or to keep people back based upon those prejudices or those discriminations or discriminatory feelings that others might feel. So I personally reject this notion of reverse racism because while the attitudes might be real, that proximity to power is missing. So I want us to keep that in the back of our minds as we go through our conversations today. The second one that I saw come up relatively frequently was around this notion of color blindness. And this resonated with me because I heard this my entire life growing up. It was taught to me as a young boy, David, it's the nice thing to do. It's the right thing to do. When you look at somebody, don't look at the color of their skin. Look at all these other things. And so this is what I was taught growing up. Don't pay attention to this piece of somebody and who they are. And then when I went into the military, you may or may not be aware, in the military, we talk about one another as, well, we're all green. They don't want you to look at race. You're all green, kind of a nice olive drab green, right? The military green. And then your superior officers or your drill instructors might say, well, we're all green. Some of us are light green Marines. Some of us are dark green Marines. That was the extent of it. And it wasn't until I had gone back to college, I was a little bit older because of the military piece. So I'm 25 years old. I'm in college. And I had the opportunity to develop this mentor-mentee relationship with a woman named Dr. Ann Lampkin Williams. She's currently one of the deans over at the University of Michigan Dearborn. And we were having our monthly check-ins. And this idea of color blindness came up one day. And I told her, this is what I've been taught. This is how I've been raised. These are the things that I've heard my whole life. It doesn't seem bad or wrong to me. What's the big deal? What's so wrong with it? And it wasn't until I was 25 years old that I had somebody sit me down, look me in the eye, and say, David, while well-intentioned, for you to say that you're colorblind or you're applying a colorblind approach when you're talking to me or interacting with me or what have you, you are not seeing the totality of me. You are not understanding the totality of my experiences. In the case of Dr. Lampkin Williams, as a woman, number one, as a Black woman, number two. And she said, so while, again, it's well intentioned, it inadvertently downplays the depth and the breadth of my experiences as a Black woman. In many ways, it helps perpetuate that injustice because you're refusing to acknowledge or see me as a whole and complete person. It is dismissive of me. And I hope, David, that you could understand and see why well-intentioned applying this notion of color blindness to your work or your approach to the world, it's missing a piece of the puzzle. It's missing a piece of me. And so we talk nowadays, as opposed to being color blind, to be color conscious, and to recognize again that all of us have very discrete and unique experiences, and it's good and it's appropriate and it's right to acknowledge and to recognize that as we move through this work. And I'll wrap up by saying they told me 3 minutes, but you all know I'm long-winded. This is how I do things. Uh, I was listening to somebody speak the other day. We're talking about DEI here today, and we know the lightning rod that this has become within our political landscape, right? And this individual I was listening to the other day said, pause for a second and think about when you're acknowledging diversity, equity, inclusion, what's the opposite of that? If you don't like DEI, if you're so opposed to DEI, what's the opposite of that? That surely you'd be in favor of. If you don't like DEI, if you don't like diversity, you must like uniformity. If you don't like equity, you must like inequity. If you don't like inclusion, you must like exclusion. And I would venture a guess that if you went and asked the 16,000 of us here at DHHS, do you think that we're a better unit, a better department, a better bureau, a better whatever, if we deployed more uniformity, inequity, and exclusion? I would venture that the guess, or I'd venture that the answer to that question would be no, absolutely not. I don't think any of us would believe that more uniformity, inequity, and exclusion is good or right. But because we are who we are, because we occupy the space that we do as an organization of our size, number one, the number of lives that we touch, number two, millions of people on a daily basis, the systems of inequality, the systems that we're talking about dismantling or improving upon, we are uniquely positioned to do something about that here at the department. And so while it might not be you, while it might not be your parents, while it might not be your grandparents, it might not be anybody in your family that ever contributed to the systemic racial inequities that we see in our world today. You, me, everybody gathered here today are now in a position to do something about it. And so I just ask that you go into our conversation today with an open mind and an open heart. I think that good dialogue, tough questions, serious dialogue is a good thing. We will become a better department because of it. We will become a better agency. You will become a better person because of it. That is the way that I have felt throughout my journey. And then recognizing that no matter where you're at in that journey, we still have a ways to go. We still have a ways to go. If you acknowledge and recognize the inequity and the injustice that exists in this world, and we acknowledge that it's happened and continues to happen and has happened for hundreds of years, we're not going to undo it over the course of one hour conversation here on Teams. It has to be a continual commitment that we make, not just to ourselves, not just to our organization, but to one another and the people that we serve. And so I thank you again for being here today. I appreciate the dialogue that we're getting ready to have. And I have completely blown past my 3 minutes. I apologize. I'm going to call in my other co-chair of the council, Jean Ingersoll, to offer a few remarks as well. Jean?
Good afternoon. Thank you, David. Thank you for sharing those two stories. I personally appreciate it. I had a similar experience with the color blindness issue or question, and that helped me. So thank you again. Good afternoon, everyone. I'm going to talk a little bit about the areas I oversee and my responsibilities. So I don't have any stories to share, but I think I can answer some questions that we've received, and maybe some of you have. So I am the Chief Administrative Officer. I oversee 6 areas in the department: policy, planning, and operational support, legal affairs, the Bureau of Emergency Preparedness, EMS, and Systems of Care, child support, Bureau of Children's Coordinated Health Policy Supports, otherwise known as BCHIPS, and the Michigan Developmental Disabilities Council. So as our CIO, I am committed to ensuring that the areas under my oversight and MDHHS as a whole are supported and advancing diverse and inclusive practices and policies. So when I examine the current state of DEI in our agency, one of my areas of responsibility is to ensure that we operate in compliance with all applicable state and federal requirements. So some of you may be aware that the federal executive branch has issued numerous directives focused on DEI, including executive orders and grant policy updates. You might be aware these directives don't define the specific terms, diversity, equity, or inclusion. So this has created a lot of questions on how these concepts are interpreted and implemented. So I hope to give you a little bit more information about that and to help you kind of understand where we are as a department and where we are going. So as a recipient of federal grant funding, we are required to adhere to certain federal grant conditions, as many of you know. For instance, the U.S. Department of Health and Human Services revised their grant policy statement recently, and they clarified that recipients are not prohibited from engaging in all DEI-related activities. So just to be sure you understand that, we do not violate any federal anti-discrimination laws. So in alignment, we are consistent with our own core values, and we are committed to non-discrimination. So we don't discriminate against any person based on race, national origin, color, sex, disability, religion, age, height, weight, familial status, partisan considerations, nor genetic information. And why I believe this is important, and when I look at addressing racial equity at MDHHS, I just want to emphasize to you all that racial equity isn't a peripheral issue. It's foundation to our mission that Brenda talked about at the beginning of the presentation, to protect and promote health, safety, and well-being of all Michiganders. So just to laser focus on what that means, we focus on equity, we fulfill our legal and ethical obligations. This helps build trust in our governmental services and improves our public health outcomes. So this just really helps us ensure that we have broader access to preventative care and treatment as required by the Public Health Code that Brenda also mentioned earlier. And these are all critical to eliminating health disparities experienced by racial and ethnic minority communities across the state. So in my role as a DEI Council co-lead, I have the privilege of collaborating with colleagues across the agency. And I think that's important because collaboration allows us to identify areas of improvement and shape policies, either in our policy area, legal or otherwise, and procedures that impact those that we serve. So we know that when racial equity is embedded into our work, the benefits are clear: better services, stronger communities, and healthier Michiganders. Which is why it's important that we continue to prioritize racial equity within MDHHS. And I'm going to turn it over to my colleague, Kim Reese.
All right. Thank you, Jean, and good afternoon, everyone. I am Kim Reese, and I am the Director of the Office of Culture, Community Education, and Leadership. I serve as one of the DEI Council co-leads. I am also the Equity and Inclusion Officer, where I proudly represent MDHHS amongst our other state governmental agencies. When I reflect upon our department's progress over the past 5 years, there have been a significant amount of gains that have been made. And there have been the establishment of the Equity and Inclusion Coin, where we recognize DEI champions who have gone above and beyond normal expectations. We have the countering bias in the interview training that panelists are required to take prior to joining an interview panel. We have a working out of class protocol, DEI action plans, coffee and conversations with our agency director. We have established employee resource groups. We've supported the equity and inclusion officers in statewide trainings. We've held book clubs, discussion series. There have just been a ton of things that we've done. We've curated an inclusion calendar. We regularly host events, trainings, presentations, and discussions across our agency, as well as we support the Michigan Human Services Anti-Racism Transformation Team's racial equity conferences. We've made a lot of progress, like I've said. But when I look back at all of the hard work that our Diversity, Equity, and Inclusion Council and its 5 action teams have made, along with many of the other work areas, and when I think about all of our advocacy efforts, I would be remiss if I were to leave out the fact that within the past 5 years, we have established the Office of Culture, Community, Education, and Leadership, which is formerly known as READY. I recognize that racial equity is hard and that there can be times where it feels as though we're not making any progress. It can feel as though we're standing still. And so I leave you to ponder this quote, and it's called Choose Your Heart. Marriage is hard, divorce is hard. Choose your heart. Obesity is hard, being fit is hard. Choose your heart. Being in debt is hard, being financially disciplined is hard. Choose your heart. Communication is hard, not communicating is hard. Choose your heart. If I could ask the person whom this piece is attributed to, Devon Bro, I would ask them to add in doing racial equity work is hard. Not doing racial equity work is hard. Life will never be easy. It will always be hard, but we can choose our heart. And I'm going to ask all of you to pick wisely. So even though it's not hard, it is worth it when you reflect upon many of the things that I just shared with you. And there are a ton more that I have not had an opportunity to share. Choose your heart. It's worth it. And with that, I am fortunate to turn it over to Janetta Churchill, who is the Director of Survey Research with the Government Alliance on Racial Equity. Janetta.
Thank you, Kim. Good afternoon, everyone. I want to thank you for coming to this. This first half of the session really set the bar for the survey data I'm going to share today. I will say that the data I'm sharing is just a snippet of all of the information you all participated and shared in the survey. The Government Alliance on Race and Equity or GARE, is a national network of governments working to achieve racial equity and advance opportunities for all. You all are one of nearly 400 jurisdictions or organizations across the country that are part of this network, and that includes cities, counties, regional, and state governments. And GARE helps provide tools to move from theory to action. Next slide, please. So what is the purpose of the survey? First, we want to look at employees' awareness and perceptions of racial equity concepts, and also what their perceptions are of the efforts going on within your work area and also across the department to advance racial equity. And we also want to provide a snapshot, the pulse of the current state of racial equity in the department that can help inform future racial equity reform. Next slide. So Brenda gave an excellent summary about racial equity definitions, and she shared earlier the definition that GARE uses. And I also want to share the definition we use of diversity, equity, and inclusion, that it's a framework that organizations can use to recognize and value differences among people, ensuring fair opportunities for everyone, and fostering a welcoming and respectful environment for all. Next slide. So out of the almost 17,000 people that were invited to participate in the survey, about 30% of employees actually completed the survey. Next slide. Um, About three-quarters were female. About 12% reported that they had a disability. The majority of employees who responded have worked at the agency for either 1 to 5 years or 11 to 20 years. So the new people and the ones who have been here longer. And about three-quarters were not managers. They were non-supervisory. Next slide. So the distribution of race was spread out. Two-thirds of the respondents were white non-Hispanic, and then another 2 in 10 respondents are Black or African American. And then there are much fewer represented from the other race and ethnicity groups. Next slide. So I'm going to share some high-level key findings today. Next slide. So we want to look at employee readiness. How ready are you to do the racial equity work? And we found that almost all of the respondents agreed that they feel competent in their interactions with people of different races, or that they have a basic understanding of concepts related to racial equity. But when it comes to institutional racism, there was less agreement that people understood it. Fewer could identify examples of institutional racism, and that's noted by the first 3 blue areas. And even fewer said that they had the tools to address institutional racism in their workplace. Next slide. About looking at employee engagement or involvement in racial equity practice, about 44% of respondents agreed or strongly agreed that they're actively involved in advancing racial equity in their work. So when people were asked what would make them be more active in advancing racial equity, 37% said, if I had more time. About a quarter said, if I had more information, then I would know what to do. And about 17% felt they would be more active if racial equity received more funding. And about 30% of respondents said that they were happy with their current level of engagement. Next slide. This slide looks at commitment. How committed are our employees and divisions, the work areas, to getting to working in racial equity? So almost a majority of respondents said that I believe my division is committed to advancing issues of racial equity. But when it came to taking action, it was less agreement. Fewer said that I agree that my division is making progress towards racial equity. Even fewer said that they believe that the division is taking concrete actions to improve the workforce equity. And only about 60% agreed that their division is taking concrete actions to increase racial equity in the community. Next slide. So looking at some racial equity strategies that are used at MDHHS, only about 25% of people reported that their division has a racial equity action plan. And I would say that only 13% of respondents reported that they use that their division uses a racial equity tool. So there are many people who just did not know about whether these tools are being used. Next slide. So when I break that data down or disaggregate it by supervisors versus non-supervisors, we see that more non-supervisors did not know whether their division had a racial equity action plan. Supervisors were more likely to answer yes, that we do. Next slide. So, as David mentioned earlier, we had some open-ended questions where people could just share their perceptions, their feelings about what past or present successes or challenges the department has had in addressing racial equity. And there were 5 top themes. The first one was human resources. People wanted to make sure that there's more equitable hiring practices and promotion practices among personnel. Second, as David did an excellent job describing, was reverse racism. There were a number of people from majority races that felt like they were not being treated fairly by African American management. And as David discussed, that isn't necessarily racism. There could be prejudice, but racism is when you couple prejudice with power. And we don't see these people in society, African Americans, being in a position of power. So prejudice could be a discussion, and you might want to have a discussion with your HR to address the factual information around promotion and management policies rather than just what your feelings are. Third, there's operationalizing. And we find that employees don't always know how to implement racial equity in their role. And that's especially after training. People are like, I learned about racial equity in my training, but now what do I do? So it's important to understand how to connect racial equity to employees' everyday work. David also gave a great story and definition of color blindness. And some people reported that they just thought we were the human race, that and that there should be no differences in race. But as David shared, we need to be able to all respect each other's experiences based on race and ethnicity and other factors. 5, on the good side, a lot of people mentioned that they believe that the department is making progress related to racial equity, both in their divisions and across the whole organization. So there was good information given about making progress. Next slide, please. So Brenda mentioned that you had a baseline survey in 2019. So we're coming back 5 years later to see what changes have happened. Have things improved? Have things stayed the same, or have they gotten worse? So I'm just gonna share a couple of slides about that. Next slide, please. So there's a concept called normalizing, and it establishes racial equity as a key value by developing a shared understanding. And this can take the form of your leadership normalizing or talking about racial equity in your workspace. So we see that the percentage of employees that reported leadership in my division communicates the importance of addressing racial inequities and achieving racial equity. It significantly went up 5 years after the first survey. So there is good news about leadership. Next slide, please. There's a concept about organizing, and it builds staff and organizational capacity and building partnerships within your intra and within your organization and between other organizations. So one thing we can look at is competencies around racial equity trainings. And we see that the percentage of employees who have received 3 or more trainings has more than doubled over the past 5 years. Next slide, please. So another way to look at organizing is partnerships. And so racial equity work groups that we discussed earlier, we see that you've gone from only 16% of your divisions having a racial equity work group to now half have a racial equity work group. So there's been great improvement in that area. Next slide. Thank you. And then there were questions asked about racial equity, but also about DEI. So what is the experience with the DEI work groups? We see that in 5 years, the divisions that participate in DEI work groups has tripled. So there's been great work done in that area. Next slide. We look at something called operationalizing, and that's what where you go from theory to action. How do we actually do the work of racial equity? So we asked employees whether they have used a racial equity tool for policy, program, or budget decisions, and the percentage of people who said, yes, I have used a racial equity tool has doubled across 5 years. Next slide. So looking at progress towards racial equity within your divisions, in 2024, more respondents agreed that their division is making progress towards racial equity, and that's shown by the first 3 blue areas on each bar. Next slide. So we also wanted to look at what progress, I said government level, but really at the DHHS level, how much progress is being made in advancing racial equity for the communities in Michigan. And there has been a major improvement in those who agree that, yes, our government is making progress. Next slide, please. So those were some highlights. There is a report that has all of the data on the over 60 questions that were asked. But to sum this up, a high percentage of respondents think that examining race is important. They have a basic understanding of racial equity and also have the capacity and willingness to engage in racial equity work. And also, most respondents believe that their division and the department overall are committed to racial equity. Next slide. We see evidence of the normalizing, having those conversations, organizing, bringing together groups, and the operationalizing, how to bring racial equity into everyday work. There's evidence that all of those activities have been going on. Changes over time suggest that the efforts that DHHS has done are having an impact, and there's a need for continued organization-wide change efforts. Next slide. So we have made recommendations to DHHS based on the GARE organizational change approach model, and that's normalizing, organizing, and operationalizing. First, we suggest that you continue using normalizing to build a shared analysis of key concepts and awareness of activities being performed both in the divisions and across the department. And this includes having more conversations within departments and getting support from leaders. Second, we want to focus on building both internal and external organizing efforts that support this work. There's an opportunity for divisions to build partnerships with groups like the DEI Council, and also looking for opportunities to partner with organizations outside, partners outside of DHHS, and that could include community-based organizations or actually community members. Finally, continue to use racial equity tools internally to operationalize and institutionalize racial equity work into the DNA of DHHS. And again, several respondents noted that even though they had training, they did not know how to apply that to their jobs. So that's an opportunity to work on the operationalizing side of things. Next slide. Oh, so it is time for me to hand it over to Heather Schrock, who is going to lead us in some questions and answers.
Thank you, Janetta. Good afternoon, everyone. You can use the Q&A portion to send in your live questions. I don't know that we'll get to everybody today. We do have some questions that were submitted prior to the town hall. So we're going to start with some of those. First question, what positive impact has DEI made at the state of Michigan? Kim, if you could answer that one for us, please.
Yes, I can do that, Heather. Thank you to whomever submitted this question. And so the positive impacts that DEI have made, you all have heard at the beginning when I spoke many of the things that we've done. But when I think about this question, there are several positive impacts that come to mind. Staff are finding community, they're finding their voice, they're shared learning within our department. We're able to service residents of Michigan better by using tailored approaches to working with different populations than we have in the past. And we're providing more accessible services, which we all know is important. We're bringing, like I said, we're bringing more voices to the table, considering multiple perspectives. And I really like that we are bringing our partners to the table at the beginning of projects versus building an item and then asking them to react to it. So that's my response to that, Heather. Thank you.
Thank you. Okay. Next question. What are other states doing to advance equity work in the current environment? Best practice based on GARE's national experience. Janetta, if you could please answer that one for us, please.
Thank you for that question. The trends that I shared today are not just unique to DHHS. We see very similar trends and very similar issues being raised, themes being raised by the employees. And so you all are not alone. There are opportunities that to partner with other jurisdictions across the country who are similar to you and doing the work. One of the things I shared about organizing is building partnerships with organizations. And an example is in Kentucky, the equity staff at the Cabinet for Health and Family Services convened an intra-agency roundtable, kind of sounds like the DEI Council, to foster collaboration and cross-pollination. And this infuses equity throughout the agency. In Colorado, the Colorado Department of Human Services established a council called the Family Voice Council to engage and learn from people who are using services and programs. This really connects it's the potential to connect DHHS with the voice of the community. And this allows for more equitable participation and equitable designing and delivery of programs and services. So there are models across the country of the work that you do and the potential way you can reach your partners.
Thank you, Janetta. Just a quick touch on how to access the Q&A section. It is up on the top of your screen when you are accessing the town hall. The Q&A is a little bubble, just like the chat. When you're in your Teams portion, it's the Q and then ampersand and A. Moving on to our next question. There were several questions that came to us asking whether or not we should still engage in DEI efforts due to federal executive orders. In one question submitted in advance, a staff person stated that they are appalled and that it is a waste of Michigan tax dollars to push the DEI ideal. MDHHS staff have asked if they are still allowed to implement DEI efforts and continue strategies to improve racial equity. Jean, if you could please answer that.
I will do my best. Thank you. If you were on earlier, I talked a little bit about the federal executive orders and other DEI directives and mentioned that those directives do not define the words diversity, equity, or inclusion. So as you may know, that leaves a lot of room for interpretation. While we as MDHHS aren't directly bound by federal executive orders, but because we are receiving federal grant dollars, we are required to comply with certain federal grant requirements. As I mentioned before, there have been several federal grant policy updates, and those have made it clear that we recipients aren't required to cease all DEI activities, but we need to avoid only those that are in violation of federal anti-discrimination laws. So I'm going to try to take some legalese out of that and state differently that it's important to understand that an employer's policies and practices to promote DEI are not synonymous with providing preferences. Preferences have been found to be unlawful. So if I was going to state that differently, I would say DEI programs they're not unlawful, and they don't necessarily provide any sort of anti-discrimination. The issue is that as an employer, we can't give preference or otherwise engage in conduct, let's say in hiring, based on certain characteristics, which I mentioned a bit before, talking about the anti-discrimination laws. And we have a non-discrimination statement about being committed to non-discrimination of any person based on a number of factors. So just to recap, preferences and acting upon preferences may be illegal and may run afoul of the federal anti-discrimination laws. But in consultation with our attorneys and many others, we know we're not giving preferences, and we can continue DEI work as such. So thank you.
Thank you very much for answering that. We have a live question. How can one be appointed and or request to be a member of the CCEI or any other equity DEI work team? Kim, if you could please respond to that one.
Yes, thank you for that, Heather. And so this question gets me very excited. So as far as being a member of CISA, whenever we have vacancies or openings, I encourage you to apply for those openings and vacancies and to spread the word to others. And so because we practice equity, we do not give preferential treatment to hiring. And so a person would have to apply and be selected for a position within the Office of Culture, Community Education, and Leadership. But the other part about that makes me excited is our DEI Council has 5 action teams, and there is an interest form. If you go to the CISA website, you will see DEI Council, and if you scroll, you will see an interest form. There is some background about our 5 action teams that you are able to read over, and if there is something that piques your interest, I encourage you to submit an interest form. And if you have any questions, then we do have a DEI@michigan.gov mailbox. Thank you, Heather.
Thank you. And last question, are we still requiring people to take DEI training? That would be the training APR 500. And what do we do if they refuse? Again, Kim, I think this one's going to you.
All right, I seem to be pretty popular today, and that is fine. So when you look at APR 500, that is our training policy that mandates annual completion of 2 online trainings, which Brenda spoke to these: introduction of health equity and systemic racism. And by nature, these trainings promote anti-discrimination. And so my response continues to be, to that second part of the question, is to approach anyone who is refusing to take trainings or mandated trainings that should be treated as insubordination. And it really depends on the details and the specific situation. So hopefully that helps.
Thank you, Kim. We do have some questions in our box, and we will get back to you. It will be available on the DEI SharePoint. after we're able to discuss the questions and get back to you, but within the interest of time, we do thank you for the questions and to our panelists for a productive conversation. And we're going to now hear from Donald with some next steps before we conclude our time together.
Thank you so much, Heather. Good afternoon, everyone. I'm Donald Beyer, and I'm a legal specialist in the Legal Affairs Administration. And I also serve on the DI Council, and I'm a co-lead for the Climate and Culture Action Teams. We're going to share next steps that we can all take following our conversation today. First off, each administration has been asked to share and discuss these survey results in their administration with their staff. And this will probably be different for each area, but we encourage you to be on the lookout for this opportunity when it is scheduled by your area's leadership. Secondly, and related, each administration has also been asked to develop goals to improve race equity in their administrations. And the DEI Council is working with leadership to develop department-wide goals to improve race equity as well. And as part of this, the DEI Climate and Culture Action Team, we will be hosting quarterly meetings through the end of 2026 to share ideas, successes, and challenges around those goals and to track progress towards those goals over the course of time. Next slide. These next set of next steps are individual. These are steps that any of us can take on our own. So as was mentioned, the Systemic Racism and Health Equity online trainings are available through the Learning Center, and a great place to build a foundational understanding of those concepts. For a deeper dive, MDHHS offers a 2-day Inside Our Minds Hidden Biases training. This will be offered later this year, so be on the lookout for the opportunity to register for this training in the Pulse. We also, in terms of our third item here, we also encourage you to seek out opportunities for self-directed learning. There's, of course, many resources out there, books, documentaries, community groups, and so forth. And the MDHHS DEI SharePoint has a list of relevant resources that you can explore to further your own learning and journey. Next, as we heard today from our leaders, I'm sorry, not next slide, back to the previous slide. A next point, as we heard from our leaders, our commitment to DEI work in the department continues. And it's helpful to share that understanding with your colleagues when the topic comes up in the course of our work together. We also encourage you, as was mentioned, to join a DEI Action Team if you'd like to deepen your involvement in DEI work here at MDHHS. The 5 action teams are climate and culture, leadership, training and professional development, service delivery, and recruitment, hiring, and retention. And then lastly, the GARE website is a great resource on race equity in general. As we are a member of GARE, MDHHS is a member of GARE, we have access also to member-specific resources that we can access. And so if you are interested in that, or if you're interested in joining an action team, please feel free to contact the DEI mailbox, mdhhs-dei@michigan.gov, and we can get everyone linked up. So finally, thank you all so much for your time today. We really appreciate it, and we look forward to working with many of you as we continue this important work. Thank you so much.